Hi, welcome back to my channel. Thanks for tuning in. Today I wanted to talk about my birth story with my first child. His name is Sebastian and he is almost 4 years old. He'll be 4 in September. And I thought I would just kind of give a rundown of my birth story with him, just so others can hear and see what is. I know I had a lot of questions about, well, what is labor like? How do I know I'm in labor? Uh, I was super convinced that I was not going to know I was in labor and that I was going to give birth in the car because I wasn't going to know. I wasn't going to know that I was actually having contractions. And now looking back, I had Braxton Hicks contractions the last, I would say at least 10, 15 weeks of my pregnancy, and I did not know that's what they were. I just thought that was him moving, that was him kicking, and it wasn't until I was pregnant with my second baby that I realized those were Braxton Hicks and actually knew what the tightening of my stomach was. So my first pregnancy, even though I had researched everything, I read the What to Expect book, I consumed pretty much everything that I possibly could about being pregnant, about giving birth, being in labor, every single aspect, every baby product, everything. And now looking back, I know it was a lot of anxiety that led me to do so much research, but a lot of it was really helpful. I will say I probably did over research, so that I just like on simple things, I couldn't decide what to use or couldn't decide what was best because there were just so many choices and things like that. So it did kind of hinder me a little bit doing so much research, but at the same time I am glad that I did because I was so well informed. And then when it did come around to my second baby, just a couple of the items didn't work as well for her as they did for my first. And then because I had done so much research, I kind of knew some other choices that I could go to without, having to do the research all again. So, anyway, so for my birth story, I will start off just by saying I had a really normal pregnancy. I didn't have any issues. All my blood work was fine the whole time. I was negative for gestational diabetes. I didn't have anything like that. No concerns. And he was growing fine. All that really great stuff that I'm still super thankful for. And so really it was just, okay, what do I want for labor, for birth, and all of that. So I knew really early on that I wanted an epidural, that I, I just didn't really want to mess with it. I didn't want to be in so much pain that I really looked back with like a negative experience. And I wanted the epidural. I wanted to be comfortable. I wanted to hopefully enjoy some of it. So my labor was about 14 hours total from start to finish, from first contraction to my baby being born. So I had been trying to induce labor, not very hard, but I was walking a lot. I was bouncing on my ball. I read you could eat spicy food, so I was spicing my food a lot, and I was eating hot Cheetos because to me that was spicy. And I was just kind of doing little things like that. I remember specifically that day I had eaten hot Cheetos. I made pork chops for dinner and I spiced them way over spiced, just trying to get as much as possible. And I had been bouncing on my ball. I had taken 2 walks that day. And I had been dilated. I don't remember how far dilated I was, but I think I was at least like 3 centimeters dilated for at least a week before I actually gave birth. So I knew, things were progressing, just didn't know when. My doctor said she really didn't think that I would make it to my due date, so I was kind of holding on to that because I was really done being pregnant. I was so uncomfortable. It was September, so it was so hot outside. I had no idea what it was like to be that pregnant when it's that hot outside, and I was sweating 100% of the time. I was melting. Inside, outside, it did not matter. I was so hot. And so that night, like I said, I did all those things, and this was a week before my due date. And I ended up taking a nap on the couch, and I was woken up by a contraction. And like I said, I'd been having some Braxton Hicks contractions, nothing consistent. And so I was really, I guess, I didn't want to just jump to conclusions that I was in labor. So I was monitoring it. So like I said, it woke me up from a nap at about 11:30 p.m. And I'm like, man, that's really strong. Like, that's the strongest one I felt. But again, I didn't want to say, oh, I'm in labor, because this is so much more powerful, this contraction. But my husband was walking our dog, yes, at 11:30 p.m. at night. And I texted him asking, hey, are you almost home? I'm having some really strong contractions, so like you need to get home really quickly. And he was just down the street, so he was home just within a couple of minutes. And when he got home, he kept asking me if we should time my contractions, because they kept coming. And I was just insistent, like, no, it's not time to time them yet. They just started. And I just kind of thought he was crazy. I'm like, look, I don't know if I'm in labor. Stop telling me I'm in labor. Like, just let me be. And I kind of turned into a totally different person, which is how he knew, okay, something is off. I think she's in labor. She's acting totally different. She's speaking to me totally different. And I was kind of yelling at him because he was secretly like typing into his phone, making a log of when I was having a contraction and how long they were lasting. And for some reason, this made me so angry, because he wasn't, because I didn't want to time them yet, because I didn't think I was in labor. And two, because he was timing them, he wasn't putting them into an app specifically to time contractions. So that just made me really angry in the moment, because to me, he wasn't even doing it right. And like I said, that's how he knew, okay, she's acting like a totally different person. Like, this is not her normal behavior. Pretty sure she's in labor. So then finally, after about 30 minutes of contractions, so I did all the things like you're supposed to move around, because if you move around, and they're just Braxton Hicks, your contractions are probably going to stop. So if you're laying down, you should stand up. If you're standing up, you should lay down. You should just move position. So I moved from the couch, I moved to the bed, I bounced on the ball, and so I just kept kind of moving around, and my contractions kept coming pretty consistently. I think we were maybe at about every 7 minutes or about every 5 minutes, and my doctor had told me to go to the hospital if I was having consistent contractions for 4 hours. So it hadn't been 4 hours, but they were really consistent at about 5 minutes apart. So at 1 a.m. I decided to go ahead and go to the hospital, because like I said, I was really scared to give birth in the car or on the way, because I didn't know, that unknown was just, it really freaked me out. So I wanted to make sure we got there with plenty of time, even if they turned me away, because I wasn't in active labor, so I at least wanted to go there and get checked. So we called my aunt, who was going to be in the room with us, other than my husband, so they were both always planned to be there in the room with me. And so like I said, by now it was 1 a.m. I called her, told her, hey, we're going to head to the hospital. So she told me, okay, let me know when you get actually admitted to the hospital, and I will come to the hospital. So we go to the hospital, and I was already pre-registered and everything, so that was super easy. I just had to show them my ID, and they had me in the system and everything, so that was super simple. And so they went ahead and set me up in a room and set me up to the monitors in a bed and all of that. But I wasn't technically admitted yet, because they would have to kind of monitor to see if I was in actual active labor to be admitted. And at that time, there was another woman giving birth, because we actually heard the bell once her baby was born. So all the doctors and nurse, like the on-call doctor and everything, was with her. So I was just kind of chilling, waiting to see if this was really it. And then at about 4 a.m., they checked me again, and they were like, okay, you've definitely been having consistent contractions, so we're going to go ahead and admit you. So at that time, they gave me painkillers. So not the epidural yet, but just painkillers to help with the contractions. So I was totally okay with that. It actually calmed me down so much I was able to take a nap, which was really nice, because, I took a couple-hour nap on the couch, and that was it. But other than that, I had been awake all day. I had gone to work, because I was waiting to take off work for maternity leave once I actually gave birth. So I was at work that day, and it was just a totally normal day. My husband had gone to work, so he had been up. He didn't even get a couple-hour nap. He had been up all day, and by now till 4 a.m. And so they admitted us, and I took a little nap, and they would move me like from side to side. And then at 7 a.m., they broke my water. So that helps you become more dilated, and a lot of people don't actually, like, their water doesn't actually just break on its own. It's really common for it not to break. Not like in the movies where all of a sudden your water breaks, which does happen to some people. It never happened to me at all. So they broke my water, and that was really weird. Just feeling like the gushing, that was a really weird feeling that I will never forget. So after that, I was progressing and, just kind of waiting for stuff to actually happen. They would come check me every once in a while, but they don't want to do too many cervical checks too often. But they would check me to see how dilated I was. And so it was the labor itself, the contractions and everything, weren't that bad because I had the pain medication. I did end up getting an epidural. It was a little early, but they told me that, if you decide a lot closer to, but if the anesthesiologist is with other patients, then, he might not make it back to you in time. And I really didn't want to take a chance for me, and it wasn't really, important enough to me to be, walking around or anything, because I wasn't walking around anyway. So I told them to go ahead and do it now because I didn't want to wait and I didn't want to lose my window. So I got the epidural, and, like I said, I just kept progressing, having more contractions. I was getting more dilated. I did get some Pitocin to help kind of speed things up a little bit. And then at noon, so about 12 hours after my first contraction, I was ready to push because I was 10 centimeters dilated. So I did not know this, but when you actually start pushing, the doctor isn't there. It's a nurse that's with you. So the nurse was there, so she would hold one leg, my aunt would hold my other leg, and then whenever I'd have a contraction, I would push. So I ended up pushing for almost 2 hours. So my doctor happened to be the doctor that was on call that day. So she was actually the one who was there for the delivery, which that doesn't always happen if there's another doctor in the practice that's actually on call. So it just happened to work out for me that my doctor was the one on call. So she knew that I was there, she knew that I was pushing, and she thought, that it was taking quite a while, because it was. So she came to see what was going on. So he had been head down for several weeks. We could feel him, we knew he was head down, so that wasn't an issue. But when she checked me when I had been pushing for so long, was that she found that his face was actually facing up instead of facing down. So his face could not get under my pubic bone. So that's why every time I would push, like, he couldn't go that extra little bit to get pushed out. So he was kind of stuck. So it wasn't anything, it wasn't like he was too big or anything. It was just because he was face up, he couldn't get out. So she actually turned him a little bit. She turned him enough. And then I remember I was like clicking for more of the epidural because I was actually starting to really feel what was going on and get that ring of fire that people always talk about. And so there was a moment where I just kind of thought, oh my gosh, like, I don't know if I can push him out. I don't know if this is going to happen. I don't know what's going to happen. And I just kept trying, and I pushed a couple more times, and out he came. And he was a little blue. He was a little blue, but he started crying pretty much immediately. They put him on my chest so we could do the skin to skin, and I was sobbing uncontrollably. I mean, I could not stop sobbing. Could not stop. And it was so emotional. It was so beautiful. It was so really indescribable. Like, the first moment you see your first baby and just, like, in amazement at how, like, you made this baby, you carried this baby, and now this baby is a real human and you're holding them. It's so wild. It's so wild. It's so hard to even put into words. But he was there. He was healthy. We did skin to skin. We started breastfeeding. He actually pooped all over me. So that was the first thing he did in his life, was poop all over me. And so that was pretty funny. And it was amazing. There was so much, I guess, kind of happening afterwards that I didn't really know about. So, like, they pull out your placenta, and I didn't know exactly what that entailed, obviously, as a first-time mom. But they pulled out my placenta, and that was kind of crazy, and, they're having to massage your stomach and make sure that everything's out, everything's okay. And then I did end up tearing, so I had to get stitched up. And I didn't know that I tore. I mean, I knew I was in a lot of pain, but I didn't know what that was. So I just asked my doctor, I'm like, what are you doing? Like, because I just saw her and she was doing something. And she's like, oh, well, you tore some, so I'm just stitching you up. And I just thought, oh my gosh, like, she's so chill about this. And I have that memory of, like, oh, like, I did not even know that happened. So, and then after that, I mean, just so many things, I guess, that I didn't realize would also be a part of it. So I didn't know how sore the rest of my body would be. I didn't know how much I would be bleeding. I didn't know, I had no clue how to take care of a baby, and I was honestly in shock that they would even send me home with this baby that I felt like I was not qualified whatsoever to take care of. Even with all the research, even with everything I'd read about and known about and learned about, I still felt like I had no clue what I was doing. Yeah, that's, I guess, pretty much it for my birth story. We did stay in the hospital for the 2 days. They have you stay 48 hours after a vaginal delivery, which is what I had. Thankfully, there were no complications. I healed really well. No complications with the baby. He didn't have any issues. He didn't have to go to NICU or anything like that. He was 6 days early, but he was 8 pounds and 6 ounces and 20.5 inches long. So he was big, he was healthy, he was, as I say, fully cooked, ready to come out. So yeah, that is my birth story. I will definitely share my birth story with my second baby in another video, but I just wanted to cover this one and just share my experience. You know, I know when I was pregnant, I was really looking for those experiences from other women and what they went through, just so I could kind of have just any kind of idea what the heck was going on, what happened. I know you can't really plan any of it, but if you can at least kind of hear about it and know a little bit about what's going on, it really helps to calm me. So if I, can just share so anybody can know a little bit of what it's like, or, things to look out for. Like, I had no idea, like, I knew head down was important, but I had no idea it mattered if they were face up or face down. I had no idea, just a lot of those things. And I guess, you learn while it's happening. But, like, I knew for my second baby, okay, is she head down? Is she face up? Is she face down? Is there any way for us to know? So there were certainly things like that I knew better the second time around. So yeah, I hope you enjoyed. Tune in for my next video. Please comment, tell me, what you want to hear about or anything that you want me to cover, and I will be happy to. Thanks. Bye.